Thank you, sir. Basically, the issue here is do I treat pre-perimetric glaucoma or not? So I think before I even start saying something, I think the checklist should be, we should ensure that pre-perimetric. Why should I say that I want pre-perimetric? Obviously, I won't say it unless I have some solid evidence for that. The evidence to that is that we have various studies, numerous publications showing us that changes in glaucoma first occur in the disc and the nerve fibrillary earlier, and subsequently we start seeing changes in the visual fields. And we have numerous studies again showing us that the extent of ganglion cell loss, at least about 30, 40 and 50%. We have many patients like this. We have an apparently normal looking disc, little asymmetry, nerve fibrillary defects, open angles, and we have normal fields, and typically we have nerve fibrillary defects. This is of course reliable fields, reliable OCT, and typical changes in nerve fibrillary looking like glaucoma. And we also have various other technologies like the RTV, which will show you pre-perimetric examples where the technology shows you changes in nerve fibrillary and the thinner ganglion cell complex as compared to fields which are apparently normal. So I don't think there's an issue about how early we can pick up glaucoma. We do pick up glaucoma earlier using imaging technology, using GCC analysis, using RNF analysis. The fields are definitely going to show up changes later. So, but what actually puzzles me here is this one. Here we have Dr. Krishnan standing across the dais here, talking about I don't treat perimetric glaucoma. But in the same hall, 2 days later, he is going to talk about the importance of RNFL changes in glaucoma. So that's Dr. Krishnan, that's for you. I see the change in color in the chameleon there. And then of course, what is more puzzling to me is number 2, is the refusal to accept new technology. So we all know that perimetry is old hat. We have changes in the visual field, we all have evidence that things are happening much later in the disease. Whereas here you have technology which is proven evidence that you are having changes in the nerve fiber layer much before changes in the visual field. I think all of us must have come from Delhi to Agra, and I'm sure you will use technology something like this. Maybe you have to come in. Many of our modern doctors, I don't think we would be using any old technology. Some of our learned doctors coming from Delhi to Agra using perimetry for diagnosing glaucoma, it would be something like this. You really can't accept. How would you say that you will treat glaucoma only when you see a visual field defect and when you see it in the optic nerve?
Is it you, Krishnadas?
I don't think it was familiar, but I'm not going to point fingers. So early diagnosis actually, ladies and gentlemen, is the way to go. Be it cancer or be it any other disease. Here you have early diagnosis, alert diagnosis for various cancers. And we are all sure that we want to diagnose cancer early. And same thing goes with glaucoma as well. We want to pick up changes much earlier. We don't want to pick up 50% RGC loss and then say you're doing post-mortem analysis for the glaucoma patient and say, yes, you have glaucoma. So here's of course tuberculosis for you, the pipeline of diagnosis for tuberculosis. You look at the years below, 2007, 2008, 2012, 2013, you'll find so many tests now available for glaucoma, for tuberculosis, that it's not even in the pipeline. Some of them are way ahead of what we have today. So obviously we can't outright reject and say I will go only for sputum analysis for tuberculosis. We are far ahead in technology. I think we really should accept technology and the evidence that is staring at us in the face, and you can't say I'm not going to treat pre-perimetric glaucoma. So let us not miss the bus while we ponder, ladies and gentlemen. Early detection is the best defense against glaucoma. If you are going to wait, till you miss the bus, I think you're going to cut a sorry figure, something like this.